I'm Kristen. Welcome to Living and Learning with ADHD. Making this video was really important to me because I had so many adults reach out and say to me, I suffer from really bad panic attacks or anxiety as a comorbid condition with ADHD. Now, Dr. Sally, that's actually very common, isn't it?
Yes, anxiety conditions, generalized anxiety, social anxiety, those type of anxiety type challenges are very common. One of the highest comorbid conditions that people with ADHD suffer from or present with. Anxiety disorders are just underneath depression in the whole prevalence of, psychological difficulties throughout the whole of the world. So it's a very common experience for many of us to get anxious in situations because of ADHD, the way the brain is wired differently. These sort of sensations could be more intense. So Kristen is going to give us an example of how her anxiety can impact on her.
I think for me growing up undiagnosed for so long, it was really difficult because, and I'm hearing these stories all around the world. For me, I didn't get diagnosed until I was 20. And so, it was really difficult. It creates a lot of distress and a lot of trauma, I think, for the person with ADHD. And for me, I kind of cruised along okay. Like I had a patch where I was younger where I had clinical depression and I had my first panic attack. And it completely rolled me. Like I've never felt anything like it. I remember just sitting there, and the only comparison I can compare it to was, the movie Jurassic Park, Sally? So where the bit where the T-Rex is kind of just sniffing right down beside them, you feel that much stress inside your body, even though nothing is actually happening in your immediate environment. And your body is responding as if it's that level of distress or that level of trauma. And I suppose it's almost like maybe with girls we tend to internalize a lot rather than externalizing it, but also in men as well. That kind of builds up and it's got to go somewhere. In some ways, a panic attack is almost your body being your friend and sort of saying, hey, there's something wrong, there's something we need to resolve here. That was when I went to a therapist for the first time. I remember saying to them, you have to make this stop. And they can't do that, which is, it would be lovely if you could, wouldn't it? just make it magically stop. What I had to learn to do was, as much as you can, relax into it and know that it's going to pass. And also this week I had 2 panic attacks for the first time in years, and I think it was maybe related to starting the channel and just wanting to do as good a job as I could. And of course, rationally I know that I'm just one person and I have to kind of delegate and just look at one video, one thing at a time. I was actually with my dad and I was going surfing, and he sort of looked at me and he's like, you're really shaky, like, are you okay? And I was like, yeah, I'm just having these panics and I don't understand why. And he was like, it's okay, kiddo, it's just me, we're going surfing, we're good, and I sort of went out in the water and I relaxed once I started surfing. When I have a panic attack, I find it's really, really important for me to kind of find something in the immediate environment to ground myself. So originally my therapist and we kind of worked on the idea of picturing, like a nice relaxing beach scene because I'm a surfer. But I found that didn't really work because my brain was so overwhelmed and so flooded with like these, I guess they're feelings from the past as well as sometimes stresses of what's happening in your day-to-day life. So it was really important to me to find something, in my immediate environment to ground myself. So I tend to, say, grip onto a desk, or if I'm in the car, a steering wheel. That kind of proprioceptive input I find really helpful. And I also go to my cat Leo and I cuddle him, and he's really amazing. I've cried into his fur many times. He's very absorbent. He's a real sweetheart. And if I'm traveling and away from home, I actually take this little kind of plush toy, which kind of looks like Leo. I know that might sound really immature, but can be like, soft kitty. Just something there to calm yourself down. I'm interested to hear what Dr. Sally would recommend as well.